Morning, everybody. First off, absolutely brilliant to see so many people on the call this morning. As you see, it's a bit more kind of like structured into one specific thing that we're talking today. In a bit, I'll hand you back over to Caitlin just to go through any of the other bits of the housekeeping that I've managed to forget. But basically what we'll have Rebecca Brown, Market Development Manager from Norfolk, talking through on the Adult Social Care Review. So that'll be a presentation. After that, you'll all have an opportunity to talk to Rebecca and other Norfolk County Council colleagues about her presentation and other kind of adjacent issues. Then we get an opportunity to talk amongst ourselves about some of the issues that have arisen, not just from Rebecca's presentation, but how the reality of life providing for you guys is.
So I've just got a few events that I want to make you aware of. So the first one is that Norfolk County Council are holding a Shaping the Market webinar, which is online on the 2nd of December. And that is going to be a session on leadership in safeguarding, risk assessment and complaint handling. And you can book on that. So I'll pop all of the details in the chat of how to book as well. Norfolk County Council are also holding 3 in-person workshops in November starting next week. So there's one in Norwich, one in Kinsale, one in Great Yarmouth. So hopefully they're spread across, so you'll be able to attend one of those. Those are to have a workshop conversation about how care is commissioned. So a really good one to get along to. And again, I'll put the details in the chat of how you can book onto those. We also have a webinar coming up with the Department of Health and Social Care, all about the Fair Pay Agreement. So they'll be giving a presentation and also trying to get some feedback from providers. So that'll be a really good one to come along to if you're interested in that, and sort of feeding into the consultation. And then one last thing, which I'll also remind you at the end of, is that we're doing our quarterly survey, which feeds into our intelligence report. So I'll pop the link in the chat for that as well, but also all the details will be sent out with our meeting highlights too. Okay, I think I've covered everything, and I'm hoping that Becky is in the meeting. I think I saw her pop up.
Good morning, everybody. I don't know whether or not I'm pinned for everybody, but I am here, so hopefully that you can all see me. My name is Becky Brown. I'm the Market Development Manager at Norfolk County Council in the Commissioning and Care Markets team, but I'm here with a couple of colleagues today, so maybe we can do some quick introductions now just so that you know who we are. So I think that we've got Leon here today, if you'd like to do a quick intro, Leon.
Yeah, thanks, Becky. Good morning, everyone. Nice to see you all. I'm Leon Ring. I'm the Finance Business Partner for Adult Social Care and Public Health at the County Council. So I'll be doing a bit on the presentation this morning, so get to speak to you all in a moment.
Fab, thank you, Leon. And then we should have Rowan here as well.
Yeah, good morning, everybody. I'm Rowan Dyson. I'm the Commissioning Manager for Learning Disabilities and Residential Care here at NCC.
Fantastic. And there might be other NCC colleagues that are on the call somewhere that I'm not aware of. So, but hello to everybody that's here today. So we are here to start talking to you all about our annual fee review process. We've got a few slides to talk you through. I'm going to be sharing the responsibility of doing that with my colleagues, and we're going to pause at different points for you to be able to ask questions and just engage with us in terms of letting us know whether, when we're talking to you about what we've found out through our fee review process so far, if it resonates with you, whether or not that you've got any experiences that you'd like to share with us, because all of your feedback is going to be really important to help us build our understanding of what it's like out there at the moment delivering care. So we will shortly be starting with Leon, who's going to be taking us through some slides which summarise the wider financial and operating context that's relevant to this year's fee uplift process. Leon, I'm sure, will be happy to take some questions at the end of that segment. And then Rowan and I are going to share some of the findings from our most recent Sector Pulse survey. And that's the point that we'd be really, really interested to hear from you guys as to whether or not it sounds like what it's like for you at the moment. Fantastic. Okay, so over to Leon to kick us off.
Thanks, Becky, and yeah, good morning again to everyone. So just as a reminder, I'm Leon Ringer, Finance Business Partner for Adult Social Care and Public Health. So I guess in terms of just starting my bit of the presentation, just by way of 2 apologies. So if you were here 12 months ago and we were doing the similar thing, you will find it's very repetitive. So the world hasn't really changed in terms of the context of what I'll be describing. If anything, there's slightly more uncertainty in what I'm about to describe to you. So if this feels very familiar, if you were here 12 months ago, then you know you're spot on. It very much is. The other apology is it may feel a bit gloomy, so I'm sitting here in a grey t-shirt on a very grey day, and I'm going to be probably talking about some very grey stuff. So apologies if you're expecting something uplifting and very exciting. I am an accountant, so typically I'm quite boring and depressing for people. So bear with me as we go through. As Becky says, you know, happy to answer any questions that you've got as we go through as best we can. And if you know, if you want to either raise hands or pop things in the chat, we can do it that way. So next slide, please, Becky. Thank you. So just as Becky described, some sort of contextual stuff really to start before we get into a little bit more detail. So as an accountant, you know, I'll start on the financial elements relating to the context of where the county council and in particular adult social care as a department is. So for us at the council, we've delivered in excess of 100 million of adult social care savings over the last 8 years. The sort of context of that being a lot of that has been through, you know, demand management, promoting independence type things, but also some efficiency pieces in there in terms of our own staffing structures, etc. But having said that, our spend on adult social care hasn't reduced. You know, that's to, you know, dampen down some of the growth that we see. So we are spending more than ever on adult social care. And interestingly, when I was just doing some research before coming into the session today, for the markets that you guys support, we spend over 250 million a year in buying care for people with learning disabilities, autism, mental health, and physical disability. So, you know, rather sort of large scale in terms of what we're actually, you know, commissioning from the market every year. The way that the county council sort of works in terms of its approach to savings is a sort of pro-ratering of the target we have. So every year we build a cycle of what we think our budget may look like for the next year or two. And often the demands on us exceed the funding that we've got available, and therefore there's a natural savings gap that we have to manage within the county council across all of its directorates. So adult social care spend about 40% of the county council's budget, and therefore that's our opening position that we normally have to look to save about 40% of the gap. The gap typically for NCC is somewhere between 40 and 60 million per annum. So that gives you a bit of a scale of the context for us. In the current financial year, we injected quite a bit of money into adult social care. So we had some sizable investments that we've made. So 59 million went into the budget. But even having injected that level of money, we are still having a difficult time in terms of managing against our budget. So in the last sort of 6 to 12 months, we've had to do a lot in terms of trying to slow down our spend. And we have had a formal recovery plan in place for just over 12 months now to make sure that you know, we're able to stay within that budget that we've set ourselves. So outside of the sort of county council's finance position, obviously the economic conditions that we all face both personally and in our professional lives still remain quite challenging. So there has been obviously some improvements in things like inflation, but that inflation still remains quite high. And we'll come back to inflation as a thing in a moment. But equally, we recognise for you guys, things like energy, insurance, food, property maintenance, etc., are still higher than they were pre-pandemic. And equally, the depending on who you blame for the crashing of the economy, interest rates in you know, borrowing, etc., are still far higher than they were pre our friend from the South Norfolk. So the next bit's really talk about, you know, the experience of Norfolk in terms of all of you, maybe not all of you actually, because you support slightly different markets, but in terms of Norfolk's ageing population, we are one of the oldest populations in England, and in particular, North Norfolk it's one of the, if not the eldest population in England in terms of the patches in North Norfolk. But equally, we know in services that you guys support, people are living longer with multiple conditions, more complex conditions at any one time, and therefore, whilst that's a great thing for us, for society, and for people, obviously that does then put strain on the levels of support you guys have to provide and we have to commission and pay for in terms of making people safe, etc. Equally, as we sort of develop, we know that people's choice and expectations are changing somewhat to being more towards personalised care, more to being home-based and community-focused, and therefore, whilst residential nursing is absolutely the right thing at the right time, we are doing things as a county council to try and make sure we have alternatives to those and can prevent those as far as possible. I'd be embarrassed to talk to you about your own workforce issues because you know far better than I around you know the continued challenges you have to retain and attract quality staff. We know wage levels are a challenge, and the competition that you will experience from other sectors in terms of trying to attract staff into the care sector. And we know international recruitment equally is a challenge at times given national policy on some of that. Care quality, so we are seeing an improving position in Norfolk. We have some variability across our care sectors. Typically, we've benchmarked really quite poorly in terms of both regional and national comparators. So this is primarily the CQC assessed, but equally we are now using more of our PAMS information. But in the last sort of 12 months, we are seeing a bit of an uptick in some of our quality assessments. So that's a really positive thing that we are starting to see the movement in the right direction for those. And I guess last but not least, in terms of context, and this will be really important for some of your sectors, will be the sort of viability and sustainability issues that are being experienced. We know we've had a number of sort of contractual handbacks, quality issues, etc., in particular in our residential and supported living services. And we know for in particular older people services, we have some geographical constraints in terms of home care, so attracting supply in some areas of Norfolk being a very rural county. So that's sort of context, and hopefully that feels sort of very similar to your own experiences in the sectors that you deliver in. Next slide, please. So just a little bit in terms of the sort of budget piece. So things haven't changed too much in terms of local government funding yet. What we're expecting is quite a big change on the horizon. So for those of you not familiar with how local government funding works, we won't actually know how much funding we're going to receive for the next financial year until around about December the 20-something. So that's when we get what we call the provisional settlement for local government. So that's not the final settlement, that isn't the final amount, but that's when we'll get our first indication of how much money we've got. So everything we're doing up until now is based on a series of modelling that we're doing and based guess estimates, etc. I've done that a disservice for my colleagues in the corporate centre, of course, but there's far complex models of that. But it is based on any intelligence we can gather because we have no certainty from government. And then we get what we call our final settlement, which typically arrives late in January. Every year the County Council has to set its balanced budget by February, so you can see how the tight window we have. So we set all of our budgets or our approaches to budget setting quite early in the year based on those best estimates. We'll start getting a bit of a sense of that when we see the autumn budget come out. So that national thing that the Chancellor will do in about a week's time. We'll get some information from that around what local government or the Ministry of Health and Communities and Local Government will be receiving, and that will give us a bit of an indication. And then also we get something called the policy statement, which gives us a little bit more detail, but not the exact thing. What government have committed to doing is something called fair funding, which is a review which they will look at the total amount that are given to each of the 150 odd local authorities. And they will look at, is that distribution fair at the moment? Does it need to be shifted? So the last time they did that was many years ago. And as we know, the population has changed, demography has changed, and therefore they're really looking at that. So first of all, we thought, because there'll be politics in some of this, we thought some of that money would go to the north of England, and in particular sort of Labour strongholds, or county councils and unitary authorities. At the moment, still slightly uncertain. We think we will be a net winner from that, but we won't really know until that comes out as part of the settlement. And equally, government have tried to listen to local authorities in terms of actually an annual cycle of funding is not sufficient, and therefore we need multiple year fundings to give us a bit more certainty on direction of travel. So this year, in theory, we should get a fair funding settlement and a 3-year settlement to give us a bit of a context in terms of where we're going. So as I mentioned a moment ago, the NCC planning gap for is typically between 40 and 60 million. So for 26-27, so next financial year, we're looking at about 62.5 million funding gap. And our share of that at the moment to try and find savings is upwards of 28 million. So that's what we're trying to do in the background of the work. And we've got our select committee tomorrow, which is an opportunity for us to talk about some of that in public. We'll come back to national living wage and CPI in a moment, but the gist of both of those is they're still, relatively uncertain for us, and they can't confirmed yet. And last but not least, whilst it's not happening overnight, I'm sure you're all aware of the Fair Pay Agreement, and the consultation is now out for that. So we'd encourage you as providers, and we as a county council will respond to that consultation. Obviously, the timescales on that at the moment are that it won't be implemented till 2028. Our initial assessment is the 500 million that government have suggested might be available for that is probably going to be quite shy. Obviously, we've got an absence of details around what that actually means for wages, but contextually wise, 500 million, when we dip it down into Norfolk's share of that, won't mean much in terms of increase in wages. So, we will challenge government on the ambition of that, but clearly we need to understand what the rules of the game are in some of that. But as providers, and I'm sure as NorCA, I'm sure you'll be responding to that consultation. Next slide. Thank you. So just talking about some of the sort of drivers in some of the annual uplift process that we do. And some of this was written slightly before the survey results, so don't get too wedded on various percentages in here. Obviously, we're considering what's come back in the various surveys, but we know typically about 60 to 70% of the costs of delivering services, and that varies slightly depending if you're a home support or a support living provider, or if you're day services or residential. We know 60 to 70% of the cost is primarily driven by labour costs, staffing, etc. And therefore, the wages that we pay in the sector are normally driven by an increase in the national living wage. So that's what we use as a proxy indicator to suggest what wages may need to go up by in our sector in Norfolk come April 2026. Obviously, that doesn't mean that we haven't got an ambition, and you as providers may very well be paying above national living wage, but that's sort of the percentage proxy that we use to see how much we may have to increase by. So it's not confirmed yet. Every year the Low Pay Commission do a piece of work for government that recommends a scaling of what they think national living wage should increase by. So their central estimate at the moment is a 4.1%. What will typically happen is you'll read on the BBC News probably the day or so before the autumn statement what the national living wage is being set at. So we should find that in probably a week or so's time. Next slide. So if 60-70% of it is driven by sort of labour, then we need an indicator for what the rest of the costs are associated with. So typically we are using for 30 to 40% of the costs are sort of more generalist in nature, and depending on which market you're working in, I've got a lot of details around what some of those costs might be, or a more generic idea of what those types of costs may be, or the breakdowns of those individual bits. So we typically use a broader measure of inflation to look at those non-pay costs. So we use the Consumer Price Index. As the graph indicates, the last few years have been challenging in terms of the Consumer Price Index and broader, that's our broad measure of inflation in the market. And we know there are some areas where actual costs for our sector have increased above inflation, and some that have been slightly below in general inflation. So the estimate at the moment is current inflation is at 3.8% as of September 2025. We use the November OBR's estimate for what next year's inflation will look like to give us an indication of what a fee uplift might look like. So again, when the autumn budget statement comes out, that's one of the pieces of information that supports that. So we'll find that out in a few weeks' time. As the graph suggests, their estimate when they did that in May suggested inflation will come down and start to flatline around about 2%. But of course, we'll be informed by whatever the most recent estimates are. So last but not least from me would be, the broader context for 26-27 will be still extremely challenging for all local governments, not just Norfolk, and in particular adult social care, both within the council and for you as providers, will still be challenging in terms of the financial environment. Still massive levels of uncertainty in terms of what funding we will receive. Hopefully our models play out to be correct, but we truly won't know for at least another 4 or 5 weeks. Really important, and we do take this very seriously at the council, the intelligence from these engagement sessions and the surveys results allows us to undertake our duties under the Care Act around understanding what the actual cost of delivery in our Norfolk sector is. So it's really sort of valuable that we continue to do these sessions and we get the feedback from yourselves, and Becky and colleagues will take you through some of the survey results in a moment. Ultimately, the fee uplift process culminates in a decision that our elected members take. So you'll see that flow into probably the late January cabinet. So it'll be one for our elected members probably in the last week of January 2026 to make a decision, and that'll be obviously a decision formed based on some of the feedback from today, etc. But affordability also plays into that alongside all of our other care market duties around sustainability and high quality care and choice, etc. Whilst we recognise, we are constrained in that way, hopefully some of the numbers we're describing today will give you a little bit of context. We try and give you a little bit of as much notice as we possibly can in terms of making decisions for you as individual businesses, but we recognise, it's not ideal to only find out about your potential uplift in February ahead of the costing being incurred in April. So hopefully, if we get multi-year settlement, we can do a little bit more forward planning around that. But happy to take any questions on any of that.
Okay, I've got a quick one. Bearing in mind the budget pressures and like you said, extremely challenging. You've had to save chunks of cash over recurring years, and in terms of, you don't really know the government's position because they're coming out with kind of vague promises, but they have their own way of doing things. What are Norfolk and other local authorities' approach to central government? Because the question is, there's just not enough money in the system, is there?
Yeah, I think that's really spot on, to be honest with you. So I guess there's two things. There's not enough money in the local government sector.
Yeah.
So that plays into how much funding then can go into adult social care, and then within adult social care, we don't believe there's enough funding to meet the continued demands piece. So the fair funding piece will probably look at more around how you distribute the cake. So if we use the cake as an analogy of the level of funding we've got, but what we continue to lobby on is that's all great, but the cake needs to be twice the size is at the moment. So what we typically do is twofold. So we will lobby government directly through our local politicians, whether that be the county councillors, but equally we will then discuss funding positions with our local MPs. So continue to speak to your local MPs about funding for adult social care. So the more we can drum that message in, the more they can take that back to Whitehall and Westminster for us. So we continue to do that as an individual local authority. But the bigger power we have is when we join with other local authorities, either through something called, so there's the Society for County Treasurers, there's the County Councils Network. So these are things that we join together with other local authorities, both regionally and nationally, to say, actually, there's a big topic here that we need to speak to you about government. So at the moment, one of the big ones that you'll see through something like the County Councils Network will be reform around SEND, so special educational needs, for example. So we continue to have that sort of thematic conversations with government. For adult social care specifically, we have our ADAS forum, so the Association of directors of adult social services. So we do that both regionally and nationally on that. So we have a seat at the table in terms of lobbying for direct government funding for adult social care. How effective it is, you'll be the judge of that. Clearly, we've seen some wins, but obviously, we continue to drum, funding for adult social care. But government are in a difficult place as well. So it's, they're between slightly a rock and a hard place. Equally, when we're looking at something like the Casey review in terms of the reform pieces, we'll engage in that process to say that's all well, we need it brought forward, we need it quicker. We can't wait for years and years, 2028 for those reforms to kick in as well.
Yeah.
But really helpful question.
Just got Michael with your hand up as well. Michael, did you want to come in?
Yeah, hi there. Yeah, I mean, I think people have focused on some massive organisations and people being paid a lot of money, and even charities, the CEOs can be paid a lot of money. But when I look at most providers, they're fairly small businesses where the owners put in blood, sweat and tears, everything they can, and and there isn't this massive profit. So I don't know how these organisations do it, and I don't want to get caught up in, God, there must be loads of money because these few massive companies, however they do, I don't know, seem to be paying themselves millions, because actually the reality on the ground is that the majority of providers aren't in that position. And you do a cost of care, and I've been involved in that for many years, where margins are capped within the exercise, which does not give you that sort of money. So, and I think that my concern is where we say, well, we haven't got enough money to pay for what it costs, so something's got to give. We've been here year after year after year after year. And again, I've done this for many years. There is only so far you can go, and where you've got owner providers who are given many hours and not paying themselves for those hours, the commitment and the dedication out there is huge. And as the person before said, you've got really high quality people, but the pressure, is building. And I think it's got to come a point where you say, okay, so this is the minimum cost of providing the service. You have to pay that, or you just don't buy as much service, because you can't do it for less.
Yeah, thanks, Michael. I remember us sitting in some of those small dingy rooms at County Hall with Steve Holland many years ago, doing fair cost for care exercises, etc., and talking about the home care and residential stuff. So yeah, absolutely recognise that. And it is a challenge for us, for a sector, to understand how excess profits are being made by some where others are scraping by. We as a commissioner and a county council, we want as much money to go in the direct care workers' pockets. We'd love to see them being paid more, and that's what we'll continue to push for, because I think you're absolutely right in terms of when I think about the care worker that comes and visits my neighbour next door, the efforts and hours they're putting in, for what they're being compensated for probably isn't reasonable. So absolutely recognise that, and that's the challenge that we will continue to put to government around. If you want a high quality workforce, they are low paid, but they are not low skilled. They are high quality workers that make massive difference in people's lives, then we need to pay them appropriately. If not, at some stage things will break, and people will go and work in Sainsbury's and other sectors, rather than do the really difficult work that is care working. So absolutely recognise that, and I think our county councillors understand. There aren't a whole swathe of providers that are making masses and masses of profits in there, and we do have to recognise there is a lower limit in terms of what we can buy. We need to work together in terms of understanding what that looks like and how we can help each other in delivering those services in the most effective way possible. And that might be slightly bigger areas of delivery, might be smaller areas of delivery. It might be things that we do that drive your costs, and vice versa, that we need to work together and understand. So continue to provide that feedback on if there are things that county council that could do differently that enable you to provide services higher quality, lower cost, then we are all ears to try and work those through. Some of them will obviously come through the survey, so thank you for those that have already been provided.
Thank you.
So Becky and Leon and Rowan, have you got more presentation to go through?
We do. We have a few more slides to go through, if that's okay.
Yes, please. Please go ahead. Yeah. Thank you.
Okay. So this next section, we've got a few slides that's specifically looking at something that we've done for 2 years now, which is called the Sector Pulse Survey. It's something that's been adapted from a survey that you might be familiar with that Care England has run for quite a few years. And we'd been looking at that information and data within that time frame and thought it was helpful, it was useful, but it was all analysed at a national level. So it left us with questions about, does it reflect our own experiences for providers in Norfolk? Would they be representative? Would they feel similar? Or actually are some of the challenges and the ways in which providers are having to respond to those challenges different in Norfolk? So we decided last year to do a local version of that survey, and we're now in our second year of repeating that. What's been great this year is that we've now got 2 years of information. So what we've been able to do is start to see how things are changing. And there's definitely been some shifts in trends, for example, this year that I'd like to share with you now. So just very briefly, some of you hopefully completed the survey, so you'll be familiar with it. Some of you might not be. So for next year, if it's something that we'll probably continue to do the same, please do keep an eye out for it. We tend to complete it sort of October time, so it builds into this timeline that Leon described earlier. 24 questions, a complete mix of multiple choice questions, but lots of opportunity for providers to tell us more. So open text boxes, looking for examples, helping us to build that evidence base. And just to give you an idea of the scale of the people that have engaged with the survey this year, so we had 338 providers engaged with the survey. What that means is that a provider clicked on the link, hopefully read the briefing that came with this survey and either started the survey but didn't necessarily complete it. And we had 138 completed surveys. That represents a 5% increase from last year, which is good. We'd like to continue to increase those numbers. But the analysis I'm going to share with you is just a bespoke version. So it relates only to working age adults, residential and nursing providers, day opportunities and supported living providers. And of that group, we had 55 responses, which represents 17% more than last year. So just to give you an idea of who completed the survey, it's really important to us that we have the right people completing the survey. And that's primarily because we ask quite specific information around financial information, total operating costs, workforce challenges and how they're changing. And obviously the more accurate information that we can gather, it just helps us build a reliable set of evidence to be able to consider as part of this process. And for this set, we had 36% of people who completed the survey were senior managers, 19% were chief exec type officers, and the remaining split were between MDs and other executive type directors. From an organisational size, most organisations who completed the survey employed between 50 to 249 people, so that was 43%, or those slightly smaller organisations that were employing between 10 and 49 people. 40% of organisations reported having no volunteers as part of their total workforce structure, but 36% of organisations had between 1 and 5% of volunteers. And that obviously differs wildly depending on what type of organisation that you're part of. So we see quite some organisations having 0% or 1% and some all the way up to 20 or 30% of their total workforce. So this is a really important one from our perspective. All of the information is, but each year as part of this fee uplift or fee review process from a county council perspective, we model lots of different potential scenarios and we use a range of different insight that we've gathered over the years. So it could be things like what was mentioned earlier, cost of care exercises, things like surveys, our day-to-day engagement with providers, open book, procurement activities. We gather all of that intelligence to help us understand cost and how that's changing. So from last year, so just sorry for context, this question, we looked at total operating costs and how much of those total operating costs were split between staffing costs and non-staffing costs, so that kind of general CPI inflation type measure. And this year, 73% was suggested is on staffing costs and 27% for non-staff. That's pretty similar to last year for these markets. I would say the split from last year was 72 for staff and 28 for non-staff. So it's edged slightly up for staffing. Represents a lot of what we've spoken about already, but also things like the employer's national insurance contributions, for example, last year was a big one too. But pretty consistent in terms of what we're being told for the main operating costs for these types of organisations. Last one for me before I hand over to Rowan. So this question asked providers to look back over the last 12 months, and we were asking questions about how much those costs have changed within that period of time. So for staff-related expenses, 64% of providers reported that those have increased significantly, so that's more than 5% in the last 12 months. The bit in brackets is now comparing to last year, so that's 13% more than last year. And 25% had reported that costs had increased slightly, so between 1 and 4.9%. That's 22% less than last year. For non-staff related expenses, 49% of providers reported that staff-related expenses have increased significantly in the last 12 months. That's 17% less than last year, but 44% had suggested that costs had increased in that 1 to 4.9% bracket, which was a 10% increase. So my understanding from what I can see from these ones is suggesting that staffing related expenses continues to rise at a higher level than some of those non-staff related expenses, but they still remain high. We had, for the next question for top 3 cost pressures, we had a big drop down list and providers voted on what they were feeling were the top 3 cost pressures. Same as last year for the top 3 for these markets. So workforce related costs, utility bills and rents and mortgages were the same as last year as the top 3. But other things that started to nudge up this year, which were different to last year, were costs relating to regulation and compliance, CQC costs, food, maintenance and insurances. Those all were much higher than last year. And I would say regulation compliance is one that we're seeing coming up more often this year across all of the markets. We then asked, how are you managing and dealing with those cost pressures? Again, the top 3 remained the same. So internal efficiency savings, utilising reserves, and then trying to find new ways of growing or increasing income. But I added a number 4 because these 2 were quite high as well. They were followed by things like having to curb investment into those businesses or organisations and staff redundancies. Then we asked organisations about their current operating position overall. So those that are currently operating in a surplus position and those that are operating in a deficit position. So 53% of organisations said they remain to be operating in a surplus position. That's actually a 15% increase on last year. 32% of organisations were in a deficit position, 13% less, but 15% of organisations were either unable to provide an answer to this one or chose not to. And then we asked, okay, so if you are operating in a surplus financial position, how has that changed over the last 12 months? 34% of providers told us that that position had decreased significantly in the last 12 months, and 22% of providers told us that that had decreased slightly in the last 12 months. Okay, I'm going to hand over to you now, Rowan.
You'll be able to keep the slides going for me.
Of course.
Becky, if that's okay, thank you. I've just got a lot of traffic appearing on my screen. It's a little bit busy at the moment.
Oh, is it? Okay,
So,
no problem.
yeah, so so just carrying on that. So we're looking at the costs and how the impact for you. So Relating to the national living wage, how have your organisation's staff-related expenses changed in the last 12 months? So obviously there's rising wage pressures, and we know about the national living wage, the impact that that's had, but obviously the impact that that's had across all pay scales within your organisations. So understanding that there is a need to increase salaries to maintain that differential rates. We hear from you in terms of the challenges you're facing around no wage increases, forcing to increase pay staff to prevent loss of staff. We recognise the challenges that you're having around that. The employers' national insurance contributions, we know that that's an issue that's affected everybody. So an additional 5 million spend for some providers. National increases made things tight. National increase in employer contributions increased, long visa costs and higher wage offerings has pushed up staffing costs significantly. As Becca reflected in the stats, we're seeing an increase in the percentage of your funds that you're having to spend on staffing costs, and we're factoring that into the conversations that we're having. Rising training, compliance and workforce development costs. Obviously, we're asking more of providers. There are new developments coming in all the time in terms of the training that people are required to have. Obviously, within working age adults, we've got the Ola McGowan training, we had PBS. There's information around the Clive Treacy working plans to look at epilepsy care and management for individuals with learning disability. There's lots more onus in terms of how we move forward. There's the work around a delegated health task, which is coming on board as well. So there is going to be a lot that's required of providers in order just to essentially stand still. And we know that that comes as a cost. But I think what's really interesting is that by you giving us this feedback, Rebecca and I had started a conversation yesterday about, well, does this give us an opportunity as a council to provide more additional help? Maybe not additional funding, but additional help. Is there something that we as a council can do to support the training and development requirements across the market to ensure that we are supporting you with all of those key objectives around maintaining your sustainability, but also supporting your quality improvement? Next slide, please, Becca. So we know in terms of non-staff related expenses, what you're telling us, rising core operating costs. So costs such as rent, energy, insurance and utilities are high. They continue to increase. Weather extremes and inflation have driven further increases in heating, cooling and day-to-day operations. What we expect is for people to be living in a comfortable environment. We know that can be a challenge when you're having to pay additional money for that. We know that there's issues around maintenance costs going up. But again, materials have gone up. We saw that during COVID. We've seen that during, obviously the impact of things in Ukraine. These things have had a knock-on effect across all marketplaces. And we also understand that, in terms of administration and compliance, elements of that link into your maintenance costs, where you're having Norfolk Fire and Rescue Service come in, where there are changes in fire regulations, often having conversations with homes who've had to replace all of their fire doors because they no longer meet the actual requirements that were expected. We're seeing providers have to increase their night staffing covers because the fire service and the CQC are saying actually, due to changes in instructions, it's no longer keep put if there's a fire, it's get out. You need to have staff in place to be able to do that. So we recognise that there are additional costs in maintaining that compliance element as well in order to keep your services moving forward. Thank you, Becky. Difficult question for everybody. Has your organisation considered exiting the market? 29% of providers who completed the service said that they had considered exiting the market in the past 12 months. I think, we are seeing a number of providers that are having challenges. In my time here at the council, I've been here 4.5 years. I think that around 50 learning disability residential homes have closed during that period. And that has been a mixture of financial concerns, financial viability concerns, and also quality concerns. So a number of those homes have closed down because of the quality issues that were identified by our IQS colleagues and by the CQC. But we know that this is a picture where costs are continuing to increase and the pressure is on you as providers. They said rising costs are squeezing out any margin. Without a margin, you can't invest in your services. If you can't invest in your services, you can't improve the quality. So it is a really difficult picture. We understand that. I think the great thing, as always, is despite those financial and operational struggles, providers are dedicated to supporting communities and staff. The future remains sustainable without improved financial support, and we hear you. And I said it may not be direct financial support that we can offer as an authority, but through our transformation agenda, we hope to be able to be doing things differently, which allow you capacity and allow you to to work in different ways, as Leon has put in the chat, looking at more community focused support, looking at how we can do things differently, looking at how we can provide additional resources into providers such as training and support around compliance issues. Hopefully that will start to release some of the burden, so you won't actually be seeing that direct cost impact for yourselves. And how can we work together differently to mitigate or minimise financial challenges or additional costs? As I said, you know, the financial challenges and sustainability, financial pressures are continuing to grow, particularly your staffing costs, and now account for over 70% of your total spend. And we know that, you know, you look at uplifts to cover those additional costs, and obviously that goes into our thinking, as Leon had said, in terms of the range of factors that we will look at in order to make a decision around the fee uplift. We do include all of these conversations. The collaboration and communication, I have always found that, you know, when things get difficult, working together is the best thing that we can do. It's pulling together for that common thing, and I think we have to bear in mind it all the time. Who are the individuals that we are supporting? You know, they are some of the most vulnerable in society. They need our support, they need our care. Certainly myself, you know, I'm committed to ensuring that we have providers who are able to deliver the right care for the people at the right time when they need it. And it's how do we get to that? And I think through collaboration, that's the way we can do it. There's things that we do need to do differently in the council. Payments, referrals and responsiveness is one of the key areas. We know that there are payment issues. There are projects underway within the council where we're looking at how we pay providers, the rationale in which how we pay providers, and trying to make systems easier so that payments can be made on time. And where there are provider queries about payments, we can deal with them in a much swifter and effective manner. So those are things that we are doing behind the scenes to try and make things better. Sustainability. We hear that sustainable care can't be delivered through short-term contracts, and certainly within working age adults, that is an area that we are moving to get rid of. We don't want to have short-term contracts. When people are placed on a certain short-term contract, essentially what will happen is when that end date on the system is reached, the payments stop. Now, unfortunately, we know that operationally we're stretched as well. We don't have enough social workers or APs to get out and review everybody on time. So by putting short-term books in place, there is a risk that worker won't get round to review somebody. They won't put the new CPLIs on the system, which will further delay payments. That's on us, and we recognise that we can make that change and we make that different for people. Workforce. So top 3 workforce related costs: increase in the national living wage, employers' national insurance contributions, and training costs. So, you know, we can try and do things around that in terms of the training element and looking at what we can deliver. We have our workforce development team. We have a range of free training that we can direct providers to, and that's a piece of work that we want to continue and look at how we can do that differently to make that difference. Pay rates within social care. Somebody mentioned earlier, you know, social care isn't easy. If you can get the same money working in Aldi, why wouldn't you? And I think, you know, part of that is around how it starts with us as well. How do we as an authority raise awareness of what a fantastic career social care can be? You know, it really is a fantastic place to work. And I think when we talk to people about social care, essentially, if you went into a school and said about social care, generally the response you'd get is, it's just wiping old people's bottoms. Well, it's not. It's much more than that, particularly in working age adults. You can make a significant difference, and it is about raising awareness of that, and it's about giving people opportunity to grow. And I think that's an area that we need to challenge the nature of social work in terms of identifying career pathways for people. I started off as a carer. I ended up in a local authority. I'm sure there's plenty of people within similar scopes like that, and that's what we try and need to encourage, to try and help with that. And again, we have our NCC workforce development team who can support you with recruitment, can help you with advertising roles, and can support you with, you know, the whole onboarding process and how that works. Hopefully, by doing that, we can start to reduce staff shortages issues. You know, if you've got a solid workforce, and we know there's providers on the call who have done really, really well in terms of ensuring they've got a full staff team, that those staff team are rewarded appropriately and given opportunities to grow. Sometimes for somebody, it can be giving access to a couple of different training courses, increase their skills in a certain area, give us some additional responsibility in a certain area. Sometimes that's just as important or more important than actually getting a few pence an hour pay rise. So again, it's about thinking differently on what we're offering people to try and mitigate that staff shortage problem. In terms of the average hourly pay, So based on the reports that we had, £13 and £14 per hour, but that was the average across all areas, not just the average for, say, care workers. So we know that there's significant differentials within that.